On 7 Up Front tonight, Dr. Muhammad Hamami, Wayne County Chief Health Strategist, joining us tonight with how the state's biggest county is coping with the new surge of COVID-19. Good evening, Doctor.
Good evening.
Well, we're going to begin tonight with how the county is assessing and responding to the current COVID surge.
Oh, absolutely. So we are mirroring, as you mentioned, we are mirroring everything that is happening in the state and seeing the increase in the cases in Wayne County. It has been always our strategy to test, detect, prevent, and be prepared. So we have increased our capacity in preparation for this surge of testing, and specifically in focusing on communities that might not have access to testing or might have the capacity. So our capacity to test with our weekend pop-up and drive-through testing has been very effective in providing access for those who might have barriers to that. We have also increased our daily testing capacity by contracting with several vendors and community organizations where anyone can go and get tested. And we believe that this strategy is going to help us in identifying cases at an early stage and certainly then try to detect it and contact trace it.
Yes, and so important too for all communities to have that access to testing. Are you working with health systems in the state and the health department? I can imagine there's a relationship there that's cohesive.
Certainly. So we certainly are in contact and direct communication with the State Department in understanding what some of the directives that many of us have heard over the weekend. What are some things that we need to implement locally that might be necessary? And also, how do we coordinate between the health systems in terms of their capacity? But also, one specific thing that we're working on with the health systems is preparing for the vaccine that all of us are aware that might be coming our way, hopefully in mid-December or by the end of December. So we want to understand what is the capacity of health systems of distributing those vaccines, who are the targeted population that we should prioritize, and what would be the role of the health department in identifying those that are at risk and contributing to that.
Yes, and in the meantime, sir, we're talking about the hand washing, the mask wearing, and now we're talking about no family for Thanksgiving. Can you speak to us about the precautions that we need to continue to take heading into next week's holiday?
That is an excellent question. So we know that these measures work, and we know that they were the reason why we saw that down and that dip in early May. And we know that because of the ease of the restrictions, we are seeing what we are experiencing now. So certainly the three things are going to be the physical distancing. We are not calling it social distancing. We still want people to be social, but we certainly want them to be at physical distance from each other. Certainly the face covering and the masking is something that have been proven to minimize the spread. And this is what we want to do. And finally, using common sense and the hand washing and the disinfectants and the hygiene. And we know that this is hard, and especially as we are getting to the holiday season. And we know a lot of families want to be together, and we want to have grandma and grandpa over the table and all that. But this is the least we can do to protect them. We need to make sure that especially our elderly and our senior population is protected. So for this holiday season, we are encouraging everyone to minimize the family gatherings that they can have to, at minimum, only a household or at least two households that have been what the state is calling podding. So they have been contacting or communicating with each other over a period of time and not exposing each other to any external visitors. But certainly our recommendation is to remain within a very limited circle.
So important to do so right now. We do see restaurants and other businesses on the governor's 3-week pause, but some are vowing to remain open in order to survive. So does the county health department have a plan for those who refuse to close?
We are certainly working with our businesses. We would love to ensure that we are helping them rather than really targeting them. So a lot of our policy in the past has been to put mitigation plans as well as to educate them on how to minimize the risk. Although the directive is now that they cannot have indoor dining, they can still have takeaway. So we make sure that when they are doing that, or if they are planning to do something outdoors, then that this is done according to what the precautionary measures that should be done. Of course, if there are violations, we do have a compliance department that we unfortunately would be regretfully looking into how do we minimize the exposure and the risk for those that still want to remain open.
Yes, Dr. Hamami, because everyone trying to survive, it is hard times for these businesses and all of us in the community trying to stay safe. We thank you so much for being with us and joining us tonight.
My pleasure. Thank you for having me.
All right.